Hi there, my name is Vic Veer. I'm an ENT surgeon working for the NHS in central London. And today in this very short video, I'm going to be talking about this thing called NasalAid, which is a new nasal dilator that the company have asked me to review. And I've also got a spare one of these. So if you'd like to be in the draw to get one of these, I'll watch to the end of this video and I'll tell you how to get one. Now, before I get onto this, you might have noticed, or people who've watched my videos before might have noticed that I've moved house again. And now I've got a completely new room for all my YouTube stuff. I've got empty bookshelves left and right. I've got token books which aren't mine, I've never read, and random photos you can see. So I will set it up, and you'll also notice I'm doing this on my phone rather than my camera, which has run out of battery because it's taking me such a long time to move house. So the second time I moved my wife and kids in 8 months, so it's less fun as exciting as it sounds. Anyway, today I'm going to talk about NasalAid, which is a nasal dilator, which I keep looking in the wrong place. I'm really sorry about this. I'll look here, sorry. NasalAid is a nasal dilator, and if you don't know what a nasal dilator is, it stops your nose from collapsing in. So I might be able to zoom in. Look at my nose. I've got a particularly bad sort of, you see how it collapses in? And that helps. The idea of nasal dilators, it rather unattractively makes you look like this afterwards. It opens up your nose and stops it from collapsing so that you can breathe a bit better. So, for example, if you feel that you can breathe better like this or better like this, it might be that the inside of your nose or the side walls of your nose are collapsing in. It says on the packaging it relieves congestion. It doesn't relieve congestion. Congestion is when the lining of your nose swells up and blocks off your breathing. It won't help that at all. If you've got rhinitis and that's the only reason you can't breathe, this is not going to help. However, if you've got a rather sort of silly nose that keeps coming in like this and you need someone to do this all night, then this thing works quite well. And I've done a video on this already, so I'll maybe put this video up here somewhere so you can look at some of the other nasal dilators that I've reviewed in the past. But this is what this NasalAid one looks like. It's basically like a bit of coat hanger wire that's been bent in a clever fashion with some soft plastic on the outside. But actually, I think it's really good. The other ones are like round cones that go into your nose and hold it open like this. And the one I thought was best at the time was Mute, which is a sort of, you can increase and decrease this little circle that can open up your nostrils. It was quite comfortable. But the problem is, and if you've used it for enough time, you'll know that it sort of presses on the inside of your septum here, this middle partition of your nose called the septum. And it can cause ulceration if you use it for too long. Now, I think that's quite rare. I've not had it myself, but I have seen some patients who've come in and said, look, it's just sort of irritating the inside of your nose. So this is quite good for that because, as I said, it does look like a cheap bit of coat hanger with a bit of plastic on the outside, but it works very well because you put it in your nose like this, so it holds, do you see how it holds this bit out a little bit? And so when you try and, even if you can just adjust it as well. You can do this to it as well, so you can make it even wider if you're desperate to, but it does hurt if you push it too much. So there's a little bit of modification, adjusting you need to do. And the other thing is, at the moment, it's pressing the top part of my nose, my rather large nose, just here. You can have it so that it lifts off your nose. So there's not actually touching your nose except for this area here, these lateral cartilages here. And actually, it's actually quite good. The trouble is, when you roll over in bed, it can come off quite easily. But if you're having trouble with maybe nosebleeds, which tend to happen in this area here called Little's bleeding area, just here and here. The reason why it's called Little's bleeding area, sorry, a tangent, you don't need to, you just skip this bit if you're not interested. But Little's bleeding area is where about 5 big blood vessels all converge at one spot here and here. So just when the kids are doing this or picking their nose, that's the area that bleeds. That's why we tend to bleed from that area here. And if Mute or one of the other dilators, which tends to rub against Little's bleeding area, causes you to have nosebleeds, well, this would work quite well because it lifts out the nose, as I said, like this, and lifts those cartilages out so your nose doesn't collapse in. Now, I'm pretty sure that the company gave me a discount code, and I'll see if I can find that. If I can, I'll put it in the video description below, but normally I forget these things. So you can buy them anywhere. I'm not attached or financially affiliated with this place at all. So I don't think you can get it on Amazon. I know you can buy it in, let me take this off, this looks ridiculous. You can buy it in America, you can buy it in England. Just Google it. I'm sure you'll find somewhere. Now, I should see if you can look at that a little bit closer. Again, I'm looking at the wrong place again. There's that QR code, and from there you can look at their website. You can have a look at it yourself. Hopefully that's been useful to you. Do take care. Thank you very much. Oh, sorry, looking here. Hopefully that's been useful to you. Thank you very much. Bye-bye.